Hey guys, Dr. Nagel here, doing a video on hyperbaric. I'm going to go through some of the conditions that can be helped with it and the science behind it. We've been wanting to do this video all week and just been too busy. So here I'm all ready to go out in the snow and do some stuff, and I just want to get this video in so you guys can, so I can deliver the science to you. Hyperbaric is basically pressurized oxygen in the blood, and it pushes out into the tissues and heals it. And so it's really powerful for your brain. And most people know Aaron and I take on cases with dementia and Alzheimer's and neurological disorders, autoimmune disorders, autism. And how we address that is we address the food. It's about 25%. Leaky gut, about 25%, and 50% of it is and big problems. But the other side of that is, what if a person has brain problems because of traumatic brain injury, or they have like scarring in their brain from diabetes or high sugar levels or whatnot? So this is just another tool to get healing into the tissues, or get those tissues to heal. So here's how it works. It actually pressurizes the oxygen. So there's oxygen in water. I open this, and this is like normal. Like I'm breathing atmospheric pressure, and there's normal oxygen, and I open that up, and I hear a little psst, and there's a little oxygen that'll come out of that. But imagine if this was pressurized, like carbonated water, which is CO2, not oxygen. But just imagine that pressure was from oxygen, and you open it up, and it goes psh, right? That's what happens with hyperbaric. So you get down when in the blood vessels, you get down to these capillaries, and the capillaries are the smallest blood vessels, and they let oxygen go out into the tissue. But what hyperbaric does is it pressurizes all that. So it pushes it deep into the tissues. Like if you've had concussions, and we all know about the traumatic brain injury with NFL players, the CTE. They get like these spots that scar, like dead tissue. And the best treatment for that is hyperbaric oxygen. I know you don't see that on the news, but that's what a lot of them, that's how they've resolved those issues. So it's an amazing treatment to push into the tissues that you're just not going to reach. Even if you did concentrated oxygen, it's not pressurized because it's at atmospheric pressure. So when you pressurize it, it pushes deep into the tissues. So, and then you can also concentrate it, which we have an oxygen concentrator that can get it up to about 80 or 90% oxygen. So more oxygen, pressurized, more healing. Hope that makes sense to you. So this is how you measure that is with Spec scans. And so this is just one case, tons of cases. Aaron and I went to a hyperbaric oxygen summit, and they just like 3 days of research showing before and afters with Spec scans, and all the physiology. And this, I just grabbed one. This is a 4-year-old autistic kid. You can look at the brain function. It's pretty low. The blue is bad, so it's down here on the lower level. After 10 hyperbaric oxygen sessions, a lot more activity. So up here in the red, so that's way up there. And this is at 25% oxygen, 1.3 ATM. That's actually what we run, is 1.3 ATM, and then we can get that oxygen up with an oxygen concentrator. I mean, we're not pumping pure oxygen in there, so no hazards whatsoever, but we can really bump it up with an oxygen concentrator and a mask. My personal experience, I've had this thing for 4 months, had it in my house. My wife and kids have all spent a ton of time in there. I would actually sleep in it. I've had a history of played football, hockey, wakeboarding, unfortunately lots of concussions, and I just can't believe how much clearer my head is, my thought process. Sometimes you don't realize how much you're fighting through fogginess, or you may your trigger for feeling anxious or stressed is like a hairpin trigger, and then when you start bringing that inflammation down and getting the brain to heal, it drops that whole threshold down. So I mean, this is lots of people walk around in their 30s and 40s that were athletes or had car accidents and kind of feel this way and just think it's just part of life and being stressful. And this is a huge tool to improve that. So I'm just going to show you the chamber. We're going to come with me. And almost forgot. Here we have, so these are pamphlets on, you know, the 3 conditions I was talking about. There's actually a whole carousel full of, you know, lots of different conditions that can be helped with it. Like, you know, I'm not going to talk about it today. So here's our hyperbaric oxygen chamber. We actually, with our patients that come in here and get in, we give them a radio so they're connected to all the staff. So we're always like, hey Jane, how you doing? Doing good, okay. You know, are your ears clearing? You know, we can talk to them in the chamber to make sure that everything's working out like we want it to. There's also a valve that if patients are claustrophobic, or we teach them how to actually, they can regulate the pressure or bring it down if, you know, their ears are, they're having trouble clearing their ears. So super safe, you know, no risk really, just if people are kind of nervous about being in an enclosed space and they're in full communication with us. So this is what it is. You know, if you have anybody that's struggling, if I hit any like key points that you know people are struggling with a little bit of anxiety, you know, they're an athlete in car accidents or have some brain fog or just energy issues, this is an amazing treatment. I would spend like 3 hours in there, sometimes during the day, sometimes at night. I would just sleep in it for a few hours, and I would just work on my computer. I'd get on my laptop and work on webinars or work on, you know, whatever I needed to work on. So that's what our patients are doing too. So that's your tip for the week.